Hello, everyone. Today we're talking about how to change your body composition after having a baby. And before I get into this episode, I want to say that this is by no means like a snap back type of message. This is simply just talking about how to build muscle if fat loss is your goal, how to incorporate that in a way that is healthy and sustainable. But I want to reiterate that this is not a fast process and there's going to take some learning. You're going to potentially, have moments where you're stepping back, where you're moving forward. So I just wanted to say that right off the bat, that this is not a snap back messaging type of thing. But today we're going to talk about what body recomposition is, how to do it for the general public, how things change postpartum, how to exercise postpartum nutrition, and about how long this whole process can take. So first off, what is body recomposition? Body recomposition means improving the ratio of fat mass to muscle mass in your body. This is generally in the form of decreasing fat mass while increasing muscle mass. And yes, you can kind of do the same thing simultaneously or do both simultaneously. But it can also be, body recomposition can also be decreasing fat mass while maintaining muscle mass, or even increasing muscle mass while maintaining fat mass. So any way you improve the ratio of fat mass to muscle mass is body recomposition. So how do you body recomposition? For the general public, body recomposition is fairly simple. It requires a slight calorie deficit or even maintenance calories for some, eating high protein, so 0.75 to 1 gram of protein per pound of body mass, and strength training. You also want to keep your overall activity high. We recommend around 150 minutes of light to moderate intensity cardio per week, like brisk walking. But you could also think about this in steps, like shooting for 10,000 steps a day or some goal like that. Calories burned in your workouts do not matter as much as we think. Yes, it is true that calories out have to be less than or have to be more than calories in order to see any fat loss or weight loss. But exercise isn't as much of a contributor to calories out as we've been led to believe. So I'd like to have people shift the way they think about exercise. And I don't recommend tracking your calories out because it's very hard to accurately and reliably track. You can track your calories in with food, and some people enjoy doing that or like to do that. I personally am someone that I feel like tracking my food really helps me. It really helps free up my mind so that I know that I'm on the right track. And I've gotten to the point where it's really easy to do. So I don't want you to think about exercise as calories burned. And I have lots of podcasts about that. So why set a goal for body recomposition and not just straight weight loss or straight fat loss? When you're attempting to lose fat, you'll need a slight calorie deficit. When your body is in that slight calorie deficit, you not only lose fat mass, but you can also lose lean mass like muscle and bone. And this negatively influences your body composition, right? That ratio of fat mass to muscle mass. It can also negatively influence metabolism and overall health. With less muscle, you have worse insulin sensitivity. You have a slightly lower metabolic rate. Your body becomes less efficient at using fat for fuel. Also, having more muscle mass improves the aging process significantly. So we want to keep, if not build, our muscle mass. But with a calorie deficit, muscle mass also goes unless you are giving your body that strong signal that you need that muscle via strength training. I also like the goal of body recomposition rather than just straight fat loss or straight weight loss because it forces you to slow down. To maintain and hopefully build lean mass, your calorie deficit just cannot be very large. This type of nutrition is more sustainable because you aren't starving all the time and you're less likely to rebound and kind of binge from overeating because you've been in such a large deficit. So because the calorie deficit isn't so severe, I think it's easier to maintain and you might feel more successful long term. And finally, I recommend body recomposition rather than just straight fat loss or straight weight loss because you'll likely like the way you look. Losing fat and building muscle really does lead to that kind of leaner, more defined physical appearance. So those are the reasons why I recommend body recomposition rather than just straight weight loss. So before we get into exercise and nutrition postpartum and body recomposition postpartum, let's talk about some considerations that are important to understand. If you are breastfeeding, you will have a change in hormones that may affect how your body builds muscle and will affect your hunger hormones. So when you're breastfeeding, you have a decrease in estrogen, specifically estradiol. This decrease in estrogen contributes to bone resorption or bone loss, which is why it's so important to strength train so that you can avoid the bone loss, because when you're loading your muscles, you're also loading bone. Studies show that when estrogen rises after breastfeeding stops, bone recovery improves. So this isn't something to panic about, but it does highlight the importance of strength training to keep your bones strong. Lack of estrogen is also associated with muscle loss, since estrogen plays a role in building muscle. So because of these hormonal shifts, it's really more important than ever to load your muscles into strength training postpartum. You may also notice that you don't build muscle as quickly during this time, and or it may take you longer to recover in between workouts. And this may be in part because of the hormonal fluctuations that are inhibiting you from recovering from exercise as quickly as you could pre-baby. All of that is normal. It just means that you need to listen. If you're super sore all the time, or if you're having achy joints, it may mean that you need to dial back the amount of exercise that you're doing and do a little bit less to allow your body more recovery time. Because remember, if you're not recovering, you're not progressing. So don't just push through thinking that it's normal. If you're feeling lack of recovery, listen to that. I'm actually in a place where I am still breastfeeding and I'm about 5 months postpartum, and I can tell I'm overdoing it a little bit with exercise. I've been trying to kind of film things before I'm going out of town, and I have also ramped up some of my commitments at work. So my stress bucket just feels a little full, and maybe that it's tipping over. And for me, when that happens, I notice that I don't recover as well. So that manifests in me feeling a little bit weaker in my lifts. Like I don't feel as strong and powerful. I sometimes will get like some minor back achiness. I'll struggle with quality of sleep, and I'll struggle with kind of mood and anxiety issues. So for me, I know that I'm in a place where I need to pull back a little bit. And what that's going to look like is instead of doing the 5 time per week EvloTrack, I'm going to do the 4 time per week EvloTrack and see how that feels for a couple weeks. It might be one of those things that I pull it back, recover, give my body a second, and then go back to what I was doing before. So again, don't be afraid to dial back if you need to, if you notice that you're not recovering. This is not going to be a linear process. If you're like me and you like objective data, you can use what's called the CO2 tolerance test to measure if you're recovering. How you do that test is you take 5 deep breaths in and out through your nose. So your deepest breaths in, your deepest breaths out. On your 6th breath, you'll breathe in as much as you can, and you'll breathe out through pursed lips, like you're breathing out through a straw. You're continuing to exhale, letting out as little air as you possibly can. You'll time that exhale. So from start the timer when you first start to exhale, and end the timer when you have your last little millimeter of breath that escapes your mouth. And if you have about 25 seconds, if you can do that for about 25 seconds or longer, you're likely recovered. If you are falling short of that 25 seconds, you might not be as recovered, and it might mean that you need to tweak your routine. Nutrition will also feel different while breastfeeding. We did a whole episode on this with Danny Patton. That's episode number 176. But your hormones change while breastfeeding, making you hungrier and making you feel less full. For many women, this manifests as a calorie surplus because they struggle to regulate behaviors around these hormones. And everyone hears, oh, breastfeeding burns a lot of calories, so you'll lose the baby weight really quickly because breastfeeding burns more calories. But for a lot of women, that isn't the case, because it's also making you a lot hungrier, and it's easy to overshoot how much you're eating when you're starving all the time, which might put you in an overall calorie surplus and affect how you gain or lose weight. All right, so those are some important considerations to understand before we get into body recomposition postpartum. We talked kind of in general about how to body recomposition and how things shift postpartum. I want to discuss specific recommendations for postpartum women, starting with exercise. First off, I don't recommend implementing any of this until you have been cleared by your doctor to exercise. So this is 6 weeks postpartum. For me, I was not concerned about body recomposition for at least 3 or 4 months, and I'm nearing 5 months, and I'm still kind of just starting to think about it. So don't feel like this needs to be any kind of rush. Just take care of yourself, take care of your baby, get your head above water, and then maybe you start to think about this. I actually worked with my pelvic floor PT to put together some kind of exercise stages that you could work on postpartum, but even still, every postpartum body is unique. And if you're having symptoms like pain, leaking, heaviness, pain with sex, don't be afraid to talk to your doctor and see about getting into some pelvic floor physical therapy. So we put together this kind of stage by stage recommendations. And when I say recommendations, this is for, again, the general public. This is not advice. Listen to your doctor. So starting with stage one. Stage one happens when you are cleared to exercise from your doctor. This is maintenance of intra-abdominal pressure with floor work and light weights or body weight. So you want to add in some Pilates type work that's really low to the ground, light weights, and you are seeing if you can maintain your intra-abdominal pressure while lightly loading your body. Again, this can start at about 6 weeks or whenever you're cleared to exercise from your provider. The goal of this stage is neuromuscular control and coordination. So connecting to your muscles so that you can load them again soon for hypertrophy. The goal of this stage is not to build muscle. It's not to burn fat. It's to reconnect to your muscle, test out how can I load my muscles and how can I regulate my intra-abdominal pressure. My physical therapist put this so beautifully. She said, if a muscle is not firing, load will very quickly feel like overload and pain rather than progressive overload or muscular fatigue. So if you're loading too quickly, you're going to backtrack. So take your time in this stage. This is all about feeling your muscles contract and start to work again. What to do in this stage? So I kind of alluded to it, but think high rep, lightweight, lots of body weight, lots of stuff on the floor, bridges, leg lifts, lightweight for the upper body, maybe some isometrics for the trunk. Staying close to the floor can really help with stability when you're working on improving that neuromuscular connection because you have a stable surface, so your nervous system feels safer. When it comes to core work, you want to establish your breath. So breathing in through the nose, breathing out through pursed lips, like you're breathing out through a straw. Gently engaging your abdominals. So I talk about this in the postpartum program, but pulling your two hip points together, pulling the rib cage together, kind of pulling pubic bone up towards belly button. And during this stage, you might actually do a Kegel while you are doing core contractions. And my physical therapist, Elizabeth, said that she does like to recommend Kegels in this stage. She said, they are muscles and we need to learn how to connect to them. She said, let's not demonize a Kegel, but let's not also do 1,000 of them and do them forever, right? And do them all the time and hyper focus on it. But we might need to kind of reestablish that coordination or that pelvic floor strength. She said, research also shows that pairing a Kegel with movement promotes a stronger pelvic floor. So let's get that in this stage so that it carries over into other stages more or less subconsciously. So during this stage one, you might kind of try a Kegel while you're doing some core work or while you're doing a leg lift or while you're doing another exercise, just to see if you can re-coordinate that. And what you'll do is you'll breathe in through pursed lips and breathe out, or breathe in through your nose and breathe out through pursed lips and try that kind of Kegel. So a Kegel is like you're squeezing your pelvic floor, like you're picking up a blueberry with your vagina. That's what I want you to think about. So in this stage, you might also experience some shaking in your muscles. You might feel fatigue in your muscles. You might feel burning sensation. All of that is fine. You aren't necessarily approaching muscular failure in this stage because you're not loading your muscles a ton. So we want to think about that high rep. You're not getting to that place where you're seeing that decrease in velocity and you have to put a ton of effort in those final few reps like we're going to do in later stages. So this stage is more focused on muscular endurance, feel your muscles work, feel the burn, things like that. You also want to make sure that with any movement that you're adding, you're not seeing an increase in symptoms. So you're not seeing an increase of pelvic heaviness, almost like you feel like that tampon is falling out feeling. So if you're feeling any of that, you either need to stop exercise, check in with your doctor, or modify, or do both. But we don't want to move through that. We don't want to move through any kind of pelvic pain. If you have a C-section, any pain with at your incision, any leaking, we don't want to move through that. So you're looking for symptoms in this stage to be like, okay, is it time for me to load my muscles? Am I having any of those symptoms? If you are, I would highly recommend going to see a physical therapist. How long should you stay in this phase? So it could be anywhere from 1 week to 3 weeks or longer, but stay at least for 1 week and work each muscle group. And how long you stay in this stage is going to depend on your symptoms. If you're not feeling symptoms, you can move on to stage 2. It also depends on how active you were during pregnancy. A lot of people have really hard pregnancies and it's hard to stay active. So you might need to stay in this stage for a little bit longer. It also depends on your delivery. If you had a really tough delivery, this might be somewhere that you stay a little bit longer. So take your time. So you'll know you're ready for the next phase if you can work kind of all of your muscle groups without any pain, leaking, heaviness. That means it's time to move on to phase 2. If you're feeling like you're not recovered from this phase, if you're feeling overly sore, you might stay in it a little bit longer. Light soreness is okay and to be expected, but extreme soreness, like I can't walk up and down the stairs, that might mean that it's time to stay here for a little bit longer until your body has a little bit more recovery. So that's stage 1. Stage 2 is we're starting to add some weight to upper body and work lower body in standing. And we want to make sure we can do all of this while maintaining that intra-abdominal pressure. So again, not feeling those symptoms of heaviness, pain, leaking. So the goal of this phase of stage 2 is starting to progress load a little bit. We're starting to add a little bit more challenge to your muscles. What you can do in this stage are progress upper body lifts. So maybe lifting a little bit heavier with your upper body. Again, breathing out through pursed lips on exertion. So for example, if you're doing a bicep curl, as you bend your elbows, breathe out through pursed lips. You may feel like you can lift close to failure in upper body if you aren't noticing symptoms. For lower body, progress to body weight standing exercises or lightweight leg exercises like lunge variations, sissy squats, wall sits. Again, making sure that no symptoms arise. If they do arise, again, get down on the floor, do the leg or the lower body stuff that you were doing in phase 1. How long to stay in this phase? Again, anywhere from 1 to 3 weeks or even longer. You might not need to stay in this phase longer than a week, again, unless you're having symptoms, which is what Elizabeth told me. And then stage 3. Stage 3, we are starting to get close to failure in most, if not all, of our lifts, and we're also adding no impact cardio. So the goal of this stage is to increase load specifically to your lower body and add some kind of faster movements. So the idea is that you're now lifting close to failure, and this can be the stage that you start to develop lean mass because you're giving your body the stimulus that causes protein synthesis or causes a buildup of muscle. Before this stage, in stage 1 and 2, you may have been able to kind of maintain what you have, but you're likely not building much in those first 2 stages. This is the stage where you kind of start to build muscle. I don't want you to hear that and feel like you need to rush to this stage because, again, setting that foundation is going to serve you for the rest of your life. But this is the stage where we're giving your muscles kind of more of that stimulus. Again, making sure that you're not having any symptoms of heaviness, pain, leaking, etc. If you are, modify, take it back, pull back the resistance, maybe get on the floor and do some more Pilates type movements if you need to. Stage 4 is, again, we're still continuing on to progressively overload all of your muscle groups, getting close to failure in all of your lifts, and you might add some light impact. Again, during this stage, you're working your arms, your legs, your core, all of those muscles close to failure as long as you're not having symptoms. You may add some light impact if that's something that you enjoy doing, if that's a form of cardio that you enjoy doing. What I did is I added tiny jump squats to my low impact cardio burst class, but I started really slow and assessed if I felt any heaviness with jumping. Of course, you don't have to jump around in your workouts if you don't want to, but if you're someone who likes to do impact cardio, you might start by adding tiny, tiny little jump squats and just a few of them, sprinkle them in and kind of see how that feels. You could do little tiny lateral hops, so little hops side to side and see how that impact feels. One thing that I had to do in this stage was before I did a jump squat, I had to do a little Kegel prior to jumping to kind of retrain my pelvic floor to tolerate impact. So that was something that my physical therapist recommended. Again, work with a physical therapist if you are having any heaviness. But again, this is something that you can start to add in this stage. Eventually, you want to work up in this stage to doing jumping jacks, jump ropes, things like that. This is a stage that I am currently in. I would say I'm in stage 4, where I am now training most of my lifts close to failure, and I'm adding in some light impact. And then stage 5, this is the final stage really where you can pretty much do anything physically that you want. So this is the stage where you're getting close to failure in all of your lifts, and you're potentially adding in really higher intensity cardio like sprints. So if you're someone who does HIIT training or sprint interval training, you can add in sprints like jump squats or sprinting or bike sprints, whatever kind of sprints that you enjoy doing. Again, you don't have to do this by any means. And this also might take you a long time to get to this stage. I'm still not in this stage, but when you do get to this stage, start adding it in really small doses. Like think like a 10-second sprint, whether you're sprinting or bike sprinting or jump squats or whatever it is. Assess your symptoms and work up from there. Again, this is a stage, I'm at this point 5 months postpartum. I'm maybe getting close to this stage. We'll see. I'm going to try some HIIT on Friday, and we're going to see how it goes. But again, do not rush into this stage. All right, so let's review real quick before we move on to nutrition. So stage 1 is really just focused on reconnecting to your muscles. You're close to the floor, you're doing lightweight, high rep, you're not focused on getting close to failure. Does not need to be the hardest workout of your life, although you definitely will probably feel some muscle fatigue during this stage because it's been several weeks since the last time you worked out or longer. Stage 2, you're starting to add a little bit more resistance. You might feel like you can lift heavier for upper body, but lower body, you're still probably keeping it lightweight or body weight. You're progressing to standing exercises. Again, all making sure that you're not feeling any of those symptoms. Stage 3 is that you're training close to failure in all of your lifts. If you're having no symptoms there, stage 4 is you're adding maybe some light impact cardio. And then stage 5 is you're adding some of that higher intensity cardio. So just know that you might toggle back and forth between these stages. I got to stage 3 and was feeling really good, rocking and rolling. And then I overdid it a little bit because I was getting excited and I had to pull back. And I kind of had to go back into stage 2 and kind of work with body weight for lower body for a little while. And then once I felt good with that, then I kind of eased back into stage 3 and then finally into stage 4. So if you're kind of toggling back and forth between these stages, know that that's totally normal. And again, we don't want to be in any kind of rush. So that's exercise. Postpartum nutrition. Now, remember, I am not formally trained in nutrition, so anything that I talk about here is from prior episodes from registered dietitians or those that are trained in nutrition. So according to Danny, who we interviewed, that was episode 176 about nutrition and breastfeeding, a good place to start for postpartum women as far as calories is maintenance. So check out the episode for all the details, but finding your maintenance calories. And if you're breastfeeding, adding maybe 450 to 500 calories to your maintenance. Start there, add in the strength training, add in the high protein. So 0.75 to 1 grams of protein per pound of body weight. And you can use your pre-pregnancy body weight if you'd like. And see if you notice any changes. See if you notice any improvements after a few weeks. You might not need to be in a super big calorie deficit, if at all, according to Danny. You might be able to stay in maintenance and see benefits and see results. And from there, you might adjust calories. It's not an exact science, according to her. It's really difficult to find your kind of calorie need. So it might take some experimenting, but you might adjust your calories a little bit. Maybe you're like, okay, I need to go into a slight deficit, 100 calories, or maybe I can eat a little bit more. One thing that another RD that we worked with, Hope Brandt, has said that I really like is to try not to be in any sort of calorie deficit or really even worry about your calories until you're getting at least 5 hours of sleep at a minimum. If you've had a baby, you know that 5 hours of sleep, although it doesn't seem like a lot, it might not happen for a long time postpartum. So it's just going to be really difficult for you to be sleep deprived and also focus on like cutting calories. It's just going to be too much stress for your body. So try not to focus on this until you're getting 5 hours of sleep at a minimum. For me, that was still way too little. I probably couldn't focus on this until I was getting like at least 7 hours. But I like the 5 hour cutoff at a minimum. And then, of course, you want to shoot for that high protein, so 0.75 to 1 gram of protein per pound of body weight per day. So that's nutrition, pairing strength training. When can you start building muscle? When does that muscle growth start to happen? A lot of people are like, how long is this going to take? First off, building muscle does take about 8 to 12 weeks to see substantial gains. However, if you trained during pregnancy, you might see your muscle come back quicker. Studies show that when you gain muscle and then lose it and then go back to gaining it again, you gain it faster the second time because you have this sort of muscle memory that allows you to see gains quicker. If you weren't training during pregnancy, you weren't doing the prenatal program, totally fine. It just might take you a little bit longer. You might not see, substantial changes in muscle mass for that 8 to 12-ish week. Now, fat loss, you might see sooner. So you can see fat loss happening after just a couple of weeks. But again, because we don't, or the RDs that I've worked with don't recommend a severe calorie deficit, it's really not going to happen fast, but you do not, trust me, you do not want to be in a severe calorie deficit. You're going to lose both muscle and fat when your calorie deficit is too large. So remember that there's a component of learning to this. Just expect it to be a little bumpy and imperfect and to be changing things until you really find a groove. In the Evlo membership, we do have a postpartum program that I taught when I was postpartum. It's 2 weeks long, but of course you can spend longer in each phase. So it's really 2 phases, the first 2 phases. And I always say that Evlo is not pelvic floor PT. It does not replace pelvic floor PT. It is not to rehab your core. We do progressive core work in the program, but any sort of rehab should be left to trained professionals, not to an online program. And although we are doctors of physical therapy, and I do think that our program is really good, it's not to treat pain or treat any sort of pelvic floor dysfunction. The purpose of the program is to help guide you back into exercise so that you can start doing the regular programming, probably with modifications for a little while, and then eventually get to training your muscles close to failure and building that muscle so that if body recomposition is a goal for you, you can start to get on your way towards that. All right, everyone, I hope this was helpful. Big shout out to Elizabeth Noble, who helped me with this episode. I am going to leave her details in the show notes. She works in Austin at a clinic called Ladybird PT. Highly recommend her and all the Ladybird staff. If you are in Austin and in need of some pelvic floor physical therapy, check them out. All right, everyone, we will see you all next week. Same time, same place. Bye for now.